Welcome to the Totally Adequate podcast, produced by Quest Analytics. Here, we dive into the latest news, policies, and innovations in healthcare provider network management with industry leaders who are shaping the future of care. Our mission? To elevate community health across the nation through superior provider networks.
Welcome to the Totally Adequate podcast. I'm your host, Kate Deiters, and on today's episode, we are discussing the executive order on price transparency, making America healthy again by empowering patients with clear, accurate, and actionable healthcare pricing information. And who better to help us unpack this than Zack Snyder, our VP of Government Affairs at Quest Analytics. Zack is here to share his insights, help us understand the nuances, and perhaps most importantly, what this means for you. Zack, I'm thrilled to have you here.
Thank you. Glad to be here.
The executive order has definitely been creating headlines and stirring conversations. Last week at the AHIP conference in Baltimore, we heard from two deputies at CMS and CSIO, both who discussed the importance of price transparency, along with their initiatives focused on provider directory accuracy. This executive order reinforces federal efforts to enhance transparency, data quality, consumer choice, and the implementation of the No Surprises Act. The overarching goal is to provide healthcare consumers with the information they need to make well-informed decisions about their healthcare choices and foster a competitive healthcare marketplace. Zack, for our listeners who are deeply entrenched in health systems or health plans and may not directly deal with pricing information, can you elaborate on why the executive order is significant, especially concerning network adequacy and provider directory accuracy?
Yes, there has been an executive order that could have an impact on network adequacy and provider directory accuracy. And that executive order is a mouthful. It is making America healthy again by empowering patients with clear, accurate, and actionable healthcare pricing information. So you might ask yourself, well, Quest Analytics deals with network adequacy, not pricing information. Why is this relevant? Well, it's relevant because it actually references an executive order from 2019 in Trump's first administration. And this is Executive 13877. I know, very exciting title of that executive order as well.
It is.
Yes, it absolutely is. But it really has three areas that we're paying attention to. So one is improving data quality in the older executive order, which the new one points to again. HHS, which is where CMS sits, is directed to enhance data accuracy and accessibility. In the promoting consumer choice of quality providers point, what it does is it ensures patients have reliable provider directory information, and that's really central to the executive order by reinforcing the importance of accurate and standardized network data. And then finally, the third piece is advancing No Surprises Act implementation. So the EO does require the HHS to implement the No Surprises Act regulations. And this includes Section 116 of the No Surprises Act, which is that section that requires the health plans to proactively outreach to providers to ensure that the data is accurate. This is something health plans are already required to do. What we could see is further regulations that would define exactly what the health plans are expected to do when outreaching to providers.
Yes, because the executive order requires the secretaries of the Treasury, Labor, and Health and Human Services to take quick actions to enforce the 2019 executive order. By May 26, 2025, they are expected to require the disclosure of the actual prices of items and services, not estimates, issue updated guidance or proposed regulatory action ensuring pricing information is standardized and easily comparable across hospitals and health plans, and issue guidance or proposed regulatory action updating enforcement policies designed to ensure compliance with the transparent reporting of complete, accurate, and meaningful data. Considering these directives, might we anticipate further developments related to the No Surprises Act, including potential new regulations focused on enhancing data quality?
We could see new regulations on No Surprises Act. We could see existing regulations or new regulations incorporate new data elements that will be focused on improving data quality. Let me point to some specific examples that we see in the executive order. In the executive order, the one from 2019 that the new one points to, in Section 5, what it does is it requires the HHS and CMS to increase access to de-identified claims data, to make that available for researchers, innovators, providers, and entrepreneurs, because the administration believes it will facilitate the development of tools that empower patients to be better informed as they make decisions related to healthcare goods and services. Well, what does that mean from the Quest perspective? It means that HHS or CMS may be looking at ways to incorporate claims data into network adequacy and provider directory requirements to ensure that provider directories are more accurate. The idea is if you could understand if a provider is active in a particular line of business, then that provider would be more available to patients. If the provider is available and seeing patients in Medicare Advantage, then they should be included in a network. If they're only seeing commercial patients, then maybe they shouldn't be included in that network.
Interesting. Well, we are observing an increased focus among regulators and lawmakers on updating provider directory requirements to ensure that healthcare providers listed in those directories are actively seeing patients accurately listed under the appropriate insurance plan and indicate whether or not they accept new patients. These changes are happening on both federal and state levels with an emphasis on using claims data to demonstrate compliance. This is definitely one of the trends that we will continue to watch and keep you updated as we learn more. So, Zach, we get this question a lot. What's your top piece of advice for anyone who is trying to stay compliant with these requirements?
The focus of the administration is on provider directory accuracy here. That is clear. So if I was in a health plan, I would be looking at what does my process look like today? What are the different departments involved in that process? Is it the provider network department? Is it the compliance department? Is it the clinical operations department? It's probably all of those departments that have some level of impact on how your health plan is really ensuring that your provider directory is accurate. So bringing all those stakeholders together and to begin to present to them some of these new trends that are occurring and really make a decision as a health plan. How are we going to meet the need for the future requirements to make sure our data is even more accurate? Are we looking at claims data? How are we bringing more data sets into our provider directory to ensure that it is the most accurate and up to date for our members?
I agree, Zach. Having answers to all of those questions will help an organization make sure that they are aligned across the board. Before we wrap up, is there anything else we need to know regarding the executive order?
The last thing I would leave the health plans with on the executive order is just to pay attention to the themes that are coming from the administration. And as the years go on in this administration, understand that we can see, or we likely will see, these themes show up in that regular rulemaking schedule, whether that is requiring the plans to bring in more data sets to ensure the accuracy of their provider directory data or network adequacy data, all the way to the No Surprises Act implementation. What are the requirements placed on you as a health plan as you proactively outreach to providers to ensure that their data is correct?
Excellent. Thank you so much, Zach. And thank you to everyone for tuning in to this episode. With so much happening right now, we will be releasing more health policy episodes this month. So be sure to subscribe, hit any of the notification bells that you need so that you are the first to know when we have a new podcast episode out. If there are any network adequacy or provider directory accuracy policies you would like us to cover on this podcast, let us know and we'll add them to our docket. Until next time, I hope you have a fantastic rest of your day.
Thank you for tuning in to this episode of the Totally Adequate podcast. If you enjoyed it, we'd appreciate it if you could rate us on Spotify or leave a review on your preferred podcast platform. Your feedback helps us grow and bring you even better content. We also invite you to send us any comments or topic ideas by emailing us at thetotallyadequatepodcast@questanalytics.com. The Totally Adequate podcast is produced by Fowler House Films and Quest Analytics. Thank you for listening.
Okay.